Hi, I'm Amy Narber, a solutions consultant at Healthy Careers. I have the privilege of working with employers and recruiters in the Northeast. And today I'm excited to talk with Priyanki Amroliwala, the Senior Manager of Talent Acquisition for 42 North Dental, and about how she's tackling rural recruiting challenges. Priyanki has worked for 42 North Dental for 6 years and is responsible for heading up dentist and specialist recruiting for over 85 practices located all across the Northeast. Priyanki has 15 years of experience in recruiting, previously working at healthcare companies located in the Northeast, both in the private duty home care sector and the senior care sector. The number of physicians per 10,000 people is 13.1 in rural areas compared to 31.2 in urban areas, according to the Health Resources and Services Administration and Rural Health Information Hub. Across the United States, the physician shortage is expected to reach 90,000 as soon as 2025, which will disproportionately affect rural areas. Employers in these regions are painfully aware of the difficulty in attracting providers since they often can't offer the level of financial compensation along with cultural, social, and other opportunities that urban areas can provide. Thanks for taking the time to talk with me, Priyanki, about this major challenge that recruiters across the country are facing.
Yeah, thank you so much for having me. I really do appreciate that. I'm very excited about today's show.
Wonderful. We appreciate it as well. So I'm just going to start off with a couple of quick questions, some background. How did you get into physician recruiting?
Uh, that's a good question. Funny question because I've basically been doing recruiting now for over 15 years. So essentially my entire career, I've been doing recruiting. I kind of fell into into the healthcare side of things just about 10, 11 years ago, something like that. When I started working for a senior care company. And that company that I work for, I was there for almost 6 years there as well. And I essentially was doing recruiting for about, I don't know, close to 75 plus skilled nursing facilities or nursing homes all across the Northeast and also into the Midwest as well. So I essentially at one point for that company was doing recruiting for nurses and nursing home administrators and, people at those long-term care facilities for those buildings. And finding nurses kind of is very similar to finding physicians. It is pretty hard, especially now during the pandemic, more so than ever. That's what I've heard through a lot of my colleagues in healthcare. But I basically was doing recruiting for healthcare in specific for a long time. And at that company that I was working for, I was also helping them find a lot of medical directors, a lot of physicians, a lot of neurologists and people and psychologists and stuff like that, that could also make rounds into those skilled nursing facilities. So I kind of started touching upon that about 10, 12 years ago, and then kind of continued into that healthcare realm and just stayed with it for so long. It's really my calling, my passion, and my drive. I really appreciate that. I feel like I'm able to make a huge difference specifically in healthcare, which is why I'm sticking with the industry. And I will tell you that currently for my organization, that's correct, what you had talked about. We have 85 plus practices all across New England, and we're growing into the Northeast as well. So I'm specifically doing a lot of recruiting for all the doctors. So I'm looking for dentists and specialists all across all of our practices that we have company wide. So the good thing here is that most of the reasons why I'm looking for dentists or specialists is actually a little less on turnover and a little more on growth. So we're very much of a growing organization right now. So we're opening up brand new practices. And we're also affiliating with a lot of practices. But having said that, most of our affiliations, most of our growth is actually starting to be a lot more in the rural areas and a lot less in the urban areas, which is why, we're all here talking today. So,
Exactly.
yeah,
Yep. So you've had experience in a lot of different areas of healthcare, it sounds like. Probably all of those have some rural recruitment. Um,
absolutely.
so
Yeah.
how did you start tackling that rural recruiting specifically?
There's so many things you can do. I feel like with experience, I've just kind of learned throughout the years. But I would tell you that essentially, what I've learned is with a lot of this rural recruiting and the strategies that you use, number one is you really have to have like legit expectations. Obviously, you're not going to get the same level of candidate or the same amount of candidates that you're going to get when you're in a big city like Boston versus when you go into a more rural area into New Hampshire. So when you're in a city, like when you're at a practice where you're trying to staff a practice in the city like Boston, you get so many candidates, or at least a lot more candidates. When I say so many, a lot more, not quote unquote that many compared to like another position. Um, but then when you go into the rural areas, we'd be lucky if we even saw one applicant that comes through. So what we've done over the years is kind of, we've allocated a lot more budget and started doing a lot more strategies for the actual areas that really have a need. And the fact of the matter is, our practices do really well in a state like New Hampshire, where it's harder to find a dentist. Yet, ironically enough, our practices are more profitable there. They do a lot more better there just because the patients in those areas are underserved. It's what you're talking about. It's what you originally said. So the patients in those areas are, more underserved areas. The patients there, number one, need the dental work or need the type of, care that the provider is going to provide to them. They're actually willing to drive further out, drive longer distances to go and see the dentist. So New Hampshire dentists, like they have patients that live over an hour away, and those patients are like willing to drive over an hour to go and see their dentist. You obviously won't get that in living in a city like Boston, like most people there don't even have a car. So they're literally going to go to the dentist that's down the street from them or right down the block from them versus traveling that far. So you have a lot more patient population that is definitely underserved. They definitely have the needs and the means to go and, take care of whatever they need to do through that provider. They're willing to drive. And then on top of that, when you work in practice, sorry, when you work in states like New Hampshire, they're not really accepting a lot of state insurances. So providers actually end up doing a lot more better there. So they actually end up making more money in states like New Hampshire, where there's no income tax. So essentially, if you're living in New Hampshire, working in New Hampshire, there's no income tax, so that's obviously a win-win. And then on top of that, you're able to see more patients and do more dentistry or do more work. So you're able to gain a better income. Yet again, you still see this issue where people can only be in and around the city and stuff like that. So we see a lot less applicants, but what we're starting to do is we're starting to strategize and, sell more on the area, talk a little bit more about why it's nice to like live in rural areas and work in rural areas, especially for a lot of students coming right out of school and stuff like that, people that really want to quickly repay their loans. It's so much better for them to work in areas like New Hampshire, where you get a lot more patients, you're able to do a lot more dentistry, and you're able to gain a bigger income. And yes, you're going to be further out than like where you lived in dental school at like BU or at Tufts or at Harvard, because you're in proper Boston. But then you're going into this area, which is still not too far away. It's only 2 hours away. And you're not going to do the same things that you got to do every day, but you still are not too far away from the city. So what we're starting to do is we're starting to like connect a lot more with our candidates and kind of talk them through those opportunities, spend more time with our candidates versus just a quick regular phone screen that we do and stuff like that. So we're spending a lot more time. We're doing a lot more strategies. We're plotting it out more so people truly understand what they're getting into. So it's no longer just about, talking to them about the job and how we pay and stuff like that. It's truly talking through with these candidates about what that opportunity looks like. Does that make sense?
It does. Yep, yep.
Yeah.
And we got some questions later that are going to cover some of that in more detail. But for now, we'll just kind of start high level. What percentage of your recruiting do you think is focused in rural areas as that need grows?
Our need is definitely growing. The struggle is definitely real. As I'd mentioned, you know what, we're opening up more practices in more and more rural areas. So I would say that at least half of my time right now, at least 50% of my time is spent trying to either develop strategies or create long-term goals or long-term strategies on how to better recruit and continue to recruit and continue to build that pipeline into the rural areas. I'm very, very little concerned about the city, or practices in and around the city in the suburbs and stuff like that. It's a lot easier to find talent in those areas. It's a bigger struggle in that. So I'm focusing at least half of my time, even though it's less openings there, but still most of my time, or a lot more of my time, is spent on that.
Yep, and that
Yeah.
makes a lot of sense. Um, are the recruiting responsibilities in your department split by rural and non-rural areas?
Nope. So the way that I split it up for our team here is really, I myself am doing everything for doctors, so everything for dentists and specialists company wide. So all 85 practices, all the long-term strategies and goals, and all the open positions and stuff like that really falls on my plate. And then we've got a team of recruiters. So we've got another team. So we've got another person that focuses just on finding dental hygienists. Again, for all 85 practices that in the states that we're located in. And then we have another recruiter that basically focuses her time on finding dental assistants and receptionists and practice managers and stuff like that for all 85 practices. So we actually don't have it split up by region. We just have it split up by position.
Okay, yep,
Yes,
so you've got a lot on your plate then. And since
definitely.
you spend a good 40 to 50% of your time on these rural recruitment opportunities, what resources specifically do you use, to help recruit rurally to try to fill these positions?
So we use the same things that like we would do for obviously all the urban areas. So all the big job boards and stuff like that we're obviously using. So that's kind of a given. That to me is almost like a check mark that always goes as part of the process. But we're spending a lot more time and costs allocated towards our recruiting, like rural recruiting strategies. So we're really thinking outside the box. So number one is, when it comes to actually finding talent, what we're doing is we're building more, bigger, better, more robust relationships with all the schools. So when you look at schools, like, we're lucky, we're here, like, we're basically 20 minutes outside of Boston. So we have three really awesome dental schools literally in our backyard. So we've got BU, we've got Tufts, we've got Harvard. But having said that, those are three really great schools in the proper city. And the fact of the matter is, most of those people, when you go to school like for 4 years and you live in that one city, you really are just used to living in that one city. So most of the people that we talk to from those schools, they're amazing schools, but a lot of their students just want to either remain in the city or around the city, or then a lot of those students are going back to the original places where they're from. So a lot of them are going down home to like Georgia or down to Florida or back to California and stuff like that. So they're already, planning to return to the states that they're originally from. Um, but what I'm doing now, but we're still kind of figuring out ways to like, get them convinced to, work in places like Maine, like New Hampshire, like Connecticut, where it's not as urban as you would be like living in and around Boston. But yet you're still only just a 2 hour ride or a 3 hour ride away from, visiting your friends home on the weekends and stuff like that. So, we're kind of convincing and starting that message up from the beginning and helping these students truly understand that if you really want to repay your loans quite fast, or if you really want to kind of gain that experience and get your hands a lot faster and stuff like that, you're gonna you have to kind of go into those practices where there's a bigger need. You're able to gain that experience a lot faster and make a higher earning or a living in those areas. So we're doing that. And then also we're doing a lot more things where we're thinking outside the box. So yes, we're doing our traditional job postings where we're posting our jobs on the job boards, and we do resume searches through all those things and stuff like that. Um, but we're also utilizing like LinkedIn. LinkedIn works really well. We have a LinkedIn recruiter account where we're individually reaching out to a lot of providers in the specific areas that we're located at, just to talk about our opportunities, or at least to get them to spread the word out to their network and stuff like that. So we're doing a lot more passive recruiting. What else we're doing is we're purchasing a list of specific providers in the areas that we're looking to recruit in. So for instance, if we're looking to recruit in New Hampshire, then we try to purchase a list of dentists in New Hampshire that are local. And we try to do, and when I say a list of dentists, I'm talking about not emails, because I feel like a lot of these dentists or whatnot, they get tons and tons of emails. We're all getting inundated with by that. So this is where a lot of my old school recruitment comes back in. So it's kind of funny. I feel like we're doing a full circle. So now what we're doing is we're purchasing the list of mailing addresses, but not business mail addresses, because obviously it's a business and we certainly don't want to solicit that. So what we're doing is we're purchasing a list of personal addresses if possible. So that's been a struggle, but we were able to obtain at least a few good vendors where I could get personal mailing addresses, and we're doing a personal mailer into these guys about our opportunities. So we're sending out personal mailers into a lot of these experienced dentists and people that live locally, talking to them about our opportunities, kind of highlighting, what the reasons are to come and join us and stuff like that. So we're doing things like that where, it's made a big difference. It's nice to open up your mailbox one evening after work and you're like, here's a job opportunity right in front of me. So that has been working pretty well for us. It's been gaining a lot more traction, and it's funny, as I'd mentioned, it's very old school strategies that are now full circle making their way back, because the job boards are great. That's all stuff. That's all great, but that doesn't really attract the passive talent. So we're now looking to really go into attracting passive talent, trying to reach out to these doctors individually to talk to them about our opportunities, or at least to kind of, make sure that they know who we are and gain that presence, if that makes sense, in front of them. So we're doing those, we're doing those things. And then we're also like, trying to make our offers more attractive by, giving them a higher compensation by working in those rural areas, stuff like that.
Yep.
Yeah.
Those are all excellent strategies. Do you also incorporate international students? Are you able to hire international students for some of these?
Absolutely, yes. Yeah, we love international students. A lot of them are basically going to dental school the second time around. So that to me is like double the amount of experience. So you're basically in dental school twice. A lot of them have experience internationally where they worked as a dentist internationally. So that to us is a win-win. Our international dentists do really well, and the good thing is, Amy, we're definitely doing sponsorship. So we do sponsorships of H-1Bs and green cards and stuff like that. So all that stuff is extremely helpful, especially in the rural areas, for sure.
Absolutely.
Yeah.
You went over a fair amount of this already, but we're just going to talk a little bit about how your strategy differs when you're recruiting rural positions. You've covered a lot of it, but if there was, anything else that you wanted to kind of fill in there, you are welcome to, or we can just move on.
Yeah, you're right. I've absolutely covered a lot of it. So I think I would kind of reiterate and say that what we're doing for our rural recruiting strategies is really, really thinking outside the box. It's essentially, quote unquote, we're trying to turn every rock. We're going to turn every rock to make sure that we truly sell our opportunities and make sure that we find that right candidate. So we are working really hard to do that and really thinking outside the box. So obviously, again, all the job boards and stuff like that, to see if, hey, even if there's someone that's looking, hopefully they'll apply. So all that stuff we're doing all the resume searches and stuff like that on the job boards. One thing, as I'd mentioned, is we're like highly utilizing LinkedIn Recruiter, where we're able to like personally send in mails to a lot of the providers in that area. You know, like I said, one more thing is what we're doing now is really purchasing a list of those providers in that specific area, where we're able to do like a personalized mailer. And then the other thing is, you know, we're building more robust relationships with a lot of the dental schools in the big cities, of course, but we're kind of doing it not last minute. We're doing it from all 4 years. So if someone goes to dental school for 4 years, year 4, they already know exactly who I am and exactly which company I represent and exactly what our opportunities are. So we're not hitting them up year 4. We've kind of been instilling this into their minds from year 1. So that's a big deal. You know, we're able, and another thing is, actually, I don't think I talked about this, is I talked about the big city dental schools and stuff like that. But what we're also doing is we're reaching out to a lot of the dental schools that are already in the rural areas. So we're also lucky. There's a really great dental school in Maine, University of New England. So that's been working well too, because you're already quote unquote in a rural area. So a lot of the students there are actually willing to kind of come and stay in rural areas, or it's actually pretty nice. A lot of the students that I talk to there are actually going back to their hometown, and their hometown is a rural area. So, you know, if I can give advice to anyone, it's, you know, to kind of strategize and really spend some time trying to figure out, or like do your research as to also where a lot of the remote schools are, where they're developing providers and stuff like that. So those are really great schools to target, because those students are really know and understand what it's like to kind of work in an underserved community. And those are the students that are actually willing to go back to either the underserved communities where they're originally from, or stay in any area that already has an underserved community. So that's been helpful. And then again, our compensation. So what we're doing is we're changing up our comp structures. So if you're working in and around the city, obviously you're going to get paid less, plus there's more competition, so you end up doing basically less money, which is fine, you know, based on whomever it is. But when you come to a more rural area, we're doing really nice sign-on bonuses. We're doing relocation bonuses sometimes. We're doing higher per diems, higher comps and stuff like that, to really sell that opportunity, to really make it attractive, and to ensure that, you know, that candidate or whomever it is that we hire really has the best deal and really knows what they're walking into, and understands who we are and how we're able to support them.
Yeah, that sounds like a great overall strategy. You know, and something that you can do for, you know, years and years. And then here along comes the pandemic, right? So that's probably changed a few things.
Mhm.
So with being in the midst of a pandemic, and seeing where these trends of people retreating from crowded urban areas, are you seeing any of those trends of it being slightly easier to recruit for rural positions?
Yeah, I wish I was, but I'm not. Yeah. I really have to tell you the truth on that. I really wish I was, but I'm not. What I've seen and what I've heard is like, and I know this for a fact, I read an article recently where it talks about, I think 8 or 9% of people in Boston, people who are living inside the city, all decide to move out the city because of the pandemic. They're no longer commuting into the city. They're all working remote, stuff like that. So I think that all changed a lot for people who are not in healthcare, or people who are in healthcare but not actually a specific provider, or kind of, you know, in the nitty gritty of healthcare. I think that people who actually are in healthcare are kind of stuck at that same place that they've always been at, just because there's been a bigger need now more so than ever. So I've actually haven't seen any provider specifically relocating to a rural area because of this, stuff like that. So
Okay. Yeah, that's
yeah,
good to know. The overall trend versus, you know, the healthcare specific one.
yeah.
Um, we talked a lot about strategies, or you talked a lot about strategies, not me, that you use to sell candidates kind of on rural positions. Um, But a follow-up question to that would be, in initial conversations with those oral surgery candidates, do you try to steer them towards the rural opportunities, even if that's not what they applied for initially?
Yeah, you know what? That's a really good question, and I'll tell you about what I've done in the past and what I've learned from. Yeah, I think in the past I was like, I would get their resume or, find a candidate or develop a lead, and I would definitely kind of steer them towards that. But you know what? In all my experiences, I realized no matter what happens, no matter how much you're going to sell and steer them towards something, sometimes when you do that, they end up running the other way and they don't even join your organization at all because they feel like you're pressuring them to do something that they don't want to do.
Yeah.
So, in all my years of experience here, I've learned to not do that. I've actually lost so many candidates because of that. So I've learned from my mistakes, and I've learned that I actually, I now allow my candidates to drive the conversation. I allow my candidates to tell me where they want to go, and it's my job to educate them. So basically, what I do is now I take on a different role. So I wear a different hat. I kind of let them drive the conversation. I'll ask them the questions as to where they want to go or what they want to do eventually. And if they talk about being even remotely interested in remote, then I kind of go into it. But when they specifically said, I just want to be in and around a big city, or I have to be in a specific area because of my children or because of family or because of friends or whatever the case is, then there's there's nothing in the world you can do to convince them to change their mind about that, because it is what it is. So I've actually learned not to steer. I allow my candidates to really drive that conversation in that situation.
Okay. Well, that kind of leads right into the next question, which is, do you think that the profile of someone who's a good fit for a rural position differs from someone who's a good fit for urban? Or is that something that you just kind of wait for them to tell you? How does that look when you're talking with a candidate?
Yeah, I think for us, I mean, like specifically for what we do, we're looking for dentists and specialists. So technically, I mean, there's a certain level of criteria that we have, when you're in the dental field. And I think in healthcare in general, obviously, really all you care about is them being a good provider and truly being there for the patients, right? I think that's number one in all areas of healthcare. And healthcare is basically patient facing. So obviously we want someone that's got good bedside manner, good chairside manner, stuff like that. So that's really important to us. And that's important to me no matter which area it's from, no matter which area it is. So be it rural, be it, big city, whatever the case is. So that kind of stays the same. But having said that, Amy, there definitely like are characteristics, but I really allow the candidate to kind of talk me through that. So a lot of candidates can openly say, well, you know, if you've got opportunities in New Hampshire, I'm interested because I love hiking and I love the outdoors and I love the four seasons and stuff like that. So that to me, like those are characteristics where, you know what, they really do want to be in a rural area and they understand that. A lot of candidates kind of understand that a lot of the rural areas are places where you can financially be more incentivized. So those are the candidates that kind of really understand that. So what I would tell you, Amy, is there's a lot of candidates. They've done their research, which I think is awesome because that means that they're well prepared and they truly know what they want and what they're looking for, and they understand like that area. So that helps because they're just a lot more well prepared than other candidates might be. Um, and then the other part is they truly want to be an area where they can get to do the outdoorsy stuff and still do indoorsy things and kind of be around all four seasons and stuff like that. So a lot of these candidates kind of speak for themselves, or if I can give any advice to anyone that's listening, which is, if they're not speaking for themselves, ask them. Like, ask them what they like to do in their free time, what is it about specific areas that they enjoy and stuff like that. So it's always, these are really nice things that you can kind of ask as an icebreaker, and also just kind of let the candidate know, hey, I want to get to know you a little bit to see, what it is that you're ideally looking for. So I think those things are helpful.
Yeah, I completely agree. Priyanka, specific to the rural candidates, the ones who may be interested in a rural opportunity, what are those candidates looking for in an employer? I mean, that probably similar things to what all candidates look for, but
Yeah. I think number one is kind of what we've already talked about is obviously compensation is big. Compensation is big no matter which area you're in. That's I think the most important thing for everyone. So compensation is big for them. A lot of candidates kind of understand and know that when they get into rural areas, there are things like a sign-on bonus where you're not going to have that in and around the suburbs of Boston. But then they also understand that these practices do a lot more because the patients are willing to drive and see the dentist or see the provider in specific areas. They kind of understand and know that. So, but those are things that they kind of ask for and verbalize from the beginning to us. So I think all that stuff is helpful.
yep. Thank you so much, Priyanki. Um, as far as new graduates are concerned, do you think that rural positions are offering what they're looking for? And if not, how would you make those positions more attractive to them?
Yeah, I think it really just depends on which new grad it is and where they're coming from. So as I'd mentioned, when you go to a dental school that's, in proper Boston and the new grad has stayed there and, just kind of hung out in the city for 4 years, it is really hard to convince them to come outside that life and step into a whole new life because it's not going to be the same thing. Absolutely not, right? Um, but I also strongly believe that the people that really want to make a difference, that truly are okay with leaving their ties behind that they've made in the past 4 years or whatnot, and truly want to go in and truly want to quickly repay their loans and do a lot of things very fast, those are the guys that are able to move and they're able to do it pretty fast. And then offering things like a sign-on bonus, a higher per diem for the dentist, less competition, more dentistry, a lot more mentorship. The things that we offer, those are very attractive for them.
Yep. Priyanka, you answered most of these questions already that this next one would cover. So I'm just going to kind of summarize. I was going to ask, are there any kind of silver bullet type strategies that recruiters should utilize that you found had the most success? And you've mentioned a number of these, so I don't know if you want to just quickly recap or if you'd like me to.
Yeah, I think I guess there's no such thing as like the perfect fit for these things. But if you want me to quickly summarize or recap, it is number one, you know, do a lot more forward planning. So if you anticipate a need for your rural area and we already know what a struggle it is, then don't start that search last minute. That's just not productive. So if I can advise organizations, it's to really strategize and do forward planning and kind of strategize on all your players, all your locations, and if you truly anticipate a need. And what I mean by that is if you feel like a provider has given you hints or has told you, hey, I'm thinking about moving, or hey, we're thinking about this, or we're thinking about this, then that's something that you need to, as an employer, need to start thinking about, like, hey, should we kind of start doing some low key advertising and stuff like that? Like, what should we do? Or at least get a plan in play, because the last thing you want is for someone to leave your area or your practice and you're really stuck without a provider. So as much forward planning as you can do, as much strategizing as you can do to stay organized and on top of your game, that will really, really help you, because it's nice to know a year in advance versus a month in advance. So that will definitely go a long way, and you'll basically have a whole year to try to find someone. So that's helpful. And then number two is, like if you have a specific budget you need to follow, make sure you allocate and save your budget for a lot of the rural recruiting. So if you're struggling trying to find a provider in and around the city, I understand that, but try to allocate as much time and money as you can more towards your rural recruiting because you're gonna need it at that time. So that's kind of my advice. And then number three is make your offer like very, very competitive. So do some research as to what the other competition in that area is doing. See if you can even up the ante just a little bit. And if it's just a little bit, that does go a long way. That gets that one provider to apply to your job versus someone else's job. And then another thing is really do a true red carpet service, red carpet interview with these candidates. So as I mentioned to you guys from the mistakes that I made in the past, allow the candidate to be in the driver's seat. You know, you as the recruiter, you as the employer, when you kind of drive and, you know, steer them towards specific things or whatnot, just know that they almost feel like they don't have control and they feel it. So allow the candidate to drive the car, allow the candidate to drive that situation to really see if it's the best fit. You really can't pressure these candidates to do what they don't want to do. It is what it is. Also, it's what I've been talking to you guys about, forward plan. So remember, reach out to all the schools in the area. Like, I mean, if you could really, if you had the budget, if you had the time to do it, reach out to every school you can, even in the US. There are so many programs out there. There's so many residents and people that are open to like relocating based on wherever they find the best opportunity. So seriously, you know, try to think outside the box, try to really strategize. Make sure you reach out to like all the residency program coordinators. Make sure you reach out to like the chief residents of each program to talk to them about that opportunity, or to at least convince their fellows or, you know, their younger classmates to potentially consider you the year after or whenever they're done. So get the word out there. Try to do a lot of these institutions or a lot of these schools are extremely political. So really, when I say build robust relationships, it's not just going in hardcore gung-ho about your jobs, because every company wants to do that. It's all about building a softer, smoother relationship with all these schools. So you have to provide an education to them. And the education is not just about your job opportunities. It's a true education. So I go into a lot of different schools talking to them about how I do resume workshops and how I teach their students or their residents on how to interview and, you know, how to look for a job and what to say and what not to say and kind of how to do all that stuff. So I have really nice presentations set up with all these schools where I'm able to provide an educational service. And that educational service is truly an educational service, not talking about jobs at 42 North Saddle. So I feel like these are all good things. And then again, what I talked to you guys about, you know, doing the mailers, doing more personalized campaigns, getting out there on LinkedIn, but doing more searches to find passive candidates, because these providers, they're basically seeing patients all day, every day, essentially anywhere from Monday through Sunday. Sometimes they're busy working. So you can't expect these guys to go on these major job boards in between a patient and expect them to apply for your job. It's just, it's not in their realm, you know. So you got to really do other things to get their attention, to capture their attention.
Priyanki, you provided some amazing advice and insights for other recruiters struggling to recruit rurally. And I think you've kind of covered everything at this point, but are there any words of wisdom you'd like to leave us with?
Don't give up. It's not an easy task. Finding healthcare providers is probably one of the most challenging jobs that you'll ever see. It's the truth for that. But it's also very rewarding. And again, don't give up. Treat the candidate with all due respect and kindness. It goes a long way. When you give your candidate that respect, when you give them that quote unquote red carpet service that I'm talking about, they really do remember you. They really feel it, and it goes a long, long way. So whether they work for you or not, trust me, I can tell you that A lot of candidates still keep in touch with me. And one of my biggest rewards is when a candidate keeps in touch with me. And even though they haven't accepted the job that I offer them, they recommend a friend to me. So that means a lot.
Absolutely. That's one of the best rewards that you can get in recruitment.
Okay.
Well, thank you so much for your time today, Priyanki. It's been wonderful. We look forward to working with you as always in the future, and have a wonderful day.
Thank you so much.